Yes, my dear, just look at the board, the Zollinger-Ellison syndrome, the SS box, how it is helpful. Let's do it. So SS box of the Zollinger-Ellison syndrome, I'm saying Zollinger-Ellison syndrome is a ZAS. So we are making, yes, ZAS is equal to ZES. That will be helpful, right? ZES means the, yes, the Zollinger-Ellison syndrome or JAS or GAS means the, yes, the gastrinoma. We can write the gastrinoma. So yes, JAS means the, we can write the gastrinoma. And this tumor, right, the gastrinoma, the name gastrin, and that should be the pancreas and duodenum. So gastrinoma is nothing but the pan and duodenum, pan-du. All right, just write it down. Gastrinoma is nothing but pan and du. So pancreatic tumor, basically, right? So this is box once again. Another box I'm writing. As I talk, right, the GAS means the Zollinger-Ellison syndrome is nothing but the ZES is nothing but the ZES. So what does it mean really? So we can write Z for, yes, it is written that the gastroduodenal, yes, the ulcers, this is important, means the multiple ulcers. We can say these are multiple ulcers. And we are saying the multiple peptic ulcer disease is a gastrin, all right, gastrin. And E, if you turn the E, you see that this E will turn like that. So this is nothing but the malabsorption. That is important. So malabsorption. So whenever you talk malabsorption, my dear, listen very carefully. I always talk, right? This is nothing but, if you M, just turn, just reverse. If I made the M just reverse like that, so it will turn like W. Means the malabsorption means the weight loss, diarrhea and steatorrhea. Just make a small box here. Means the malabsorption means the weight loss, diarrhea, steatorrhea. Or we can say diarrhea, steatorrhea, weight loss. Diarrhea, steatorrhea, weight loss is the malabsorption. And here's the S tendon. As tendon, this is very important, the secretin stimulation test. Secretin stimulation test is a diagnostic test. Secretin stimulation test is a diagnostic test, but sometimes you do the fasting gastrin level sometimes, all right? So if you can write the fasting, we can write the S, all right? Serum fasting gastrin level. Serum fasting gastrin level is a screening test. Within the bracket is a screening test. I'd like to discuss a little bit more about the test, diagnostic test. As I talked about the secretin stimulation test is another box. So it is said that the Zollinger-Ellison syndrome is diagnosis by, yes, number one test is the secretin stimulation test. So this test is done by assessment of the serum gastrin level. We measure the serum gastrin level after administration of IV, after IV secretin. After administration, after IV secretin. the normal response will be serum gastrin level will be reduced. Means the suppressed. We call this is suppressed. In contrast, in a patient with the JAS, what will be happen here? The serum gastrin level will be more and more ups. This is the one test we can do, or the second test, measurement of gastric acid output, just write it down. Measurement of gastric acid output. Yes, gastric acid output after pentagastrin administration. After pentagastrin administration. Just write it down, after pentagastrin. So in a normal response, in a normal person, that the gastric acid output means the gastric acid production will be reduced. We are writing the gastric acid output, right, will be reduced. But in case of gastrinoma, means the ZAS, gastric acid output will not suppressed. And one of the important things that we need to write here, within the bracket, just write it down, man 1. So this is the box, my dear. This is very important box here. I need to discuss a little bit more, right? So starting with the first box, the Zollinger-Ellison syndrome, JAS is a gas. Say with me, JAS is nothing but the gas, means the gastrinoma. That's it. So gastrinoma pan, all right, pan-du, all right, that will be helpful. Gastrinoma is a pancreatic and duodenal tumor. Second box is nothing but the JAS is a gas. So once again, GES stands on G for gastroduodenal ulcers. That is the multiple ulcers once again. E stands on the malabsorption. You see the E for the malabsorption. Yes, E stands on the malabsorption. We made it M. Malabsorption and MAN1. Say with me, malabsorption, MAN1. And malabsorption is nothing but the bundle pack. I'm turned the W, all right. M making to the W. You see the weight loss, diarrhea, steatorrhea. Or you can say the diarrhea, steatorrhea, weight loss. Or whenever I say the malabsorption, just M turn, weight loss, diarrhea, and steatorrhea. Remember. And secreting stimulation test, all right. We can write the SST is a diagnostic test. SST is a diagnostic test. So we can write this is the SST is a diagnostic test. And serum fasting gastrin level is a screening test. Yes. Yes, the diagnostic test, of course, this is the heading is an SST. Another one, the gastric acid output, the GAU. We can write the GAU. So we can write the SST/GAU. This is important. So yes, the secreting stimulation test in a serum gastrin, the serum gastrin level will be suppressed after secretin. All right. But in case of JAS, it will be increased. And also the gastric acid output test after pentagastrin. Remember the pentagastrin. Yes. in case of JAS is not suppressed. So the summary talk is that JAS means gas, gastrinoma pan-due, all right? Second box, you see the second box. The JAS is G for gas, or gastroduodenal, E for malabsorption, multiple, and also the MAN1. And once again, S for SST, secretin stimulation test, or serum fasting gastrin level, the screening test. And then the diagnostic done by the SST and GAU. That would be helpful, yes. I hope that these colorful boxes will be helpful, my dear. Thank you very much. If you like our videos, don't forget to subscribe our channel and click on bell button to get more updates.